Today, we finally put a number on it. The clock that starts after an Andes virus exposure, and what it takes to get off the watch list. This is Hantavirus Watch. The ECDC published rapid scientific advice on May 9th, specific to Andes instead of hantavirus broadly, and today that document is at the center of the show. Brian's been asking for a day count all week. We may actually have one.
If today's show was useful, follow us wherever you're listening. The next one will be waiting. If I was on the Hondius, or I hugged a passenger at the airport when they got home, how long am I actually looking over my shoulder? And at what point can I just stop worrying?
Right, and this is where the incubation window matters. Officials are using what we know about Andes virus specifically, rather than hantavirus in general, because Andes behaves differently. The ECDC's rapid scientific advice, published May 9th in direct response to the Hondius cluster, lays out contact categories based on the level and timing of exposure, because that window determines who needs monitoring and for how long. The CDC's Andes-specific interim guidance, issued May 10th, reinforces that framework for U.S. public health departments managing returning passengers. Clinically, CDC says early Andes symptoms can look like the flu: fever, muscle aches, fatigue, and the disease can escalate to a severe respiratory illness called Hantavirus pulmonary syndrome. The CDC's public health message is blunt. If you think you had contact with someone who has Andes virus and you're having any symptoms, contact a medical professional immediately. Don't wait to see if it passes. ECDC also calls out people involved in disembarkation, transfer, and care of passengers and crew, so officials are looking at the full chain of contact, not just the ship.
You mentioned Andes behaves differently. What's the thing that makes public health officials more nervous about this strain compared to, say, the hantavirus cases we occasionally hear about in the American Southwest?
The short answer is human-to-human transmission. CDC notes that Andes virus can spread, rarely, through contact with a sick person. And sin nombre virus, the strain behind most U.S. cases, hasn't been documented doing that. That's why the Hondius cluster triggered international contact tracing across multiple countries, instead of a straightforward rodent exposure investigation. Next, watch for ECDC updates to its case count. The May 9th document said it would be refreshed, with a June 2nd update already flagged. And if you or someone you know was on that ship, find your local health department, report your travel, and don't self-dismiss symptoms. Emerging Infectious Diseases has been tracking this, so that incubation window we just walked through has to come from somewhere. You can't just borrow it from Sin Nombre. This 2023 dispatch in Emerging Infectious Diseases is part of the reason. A Syrian hamster model, Andes-specific, focused on the mechanics of human-to-human transmission. The evidence comes from an animal model rather than a clinical trial, but it helps explain why Andes needs its own clock.
A hamster study. Okay. But, and I mean this seriously, does the transmission timeline in that model actually line up with what the ECDC is using for the Spain contacts right now? Because if the animal data and the human surveillance window are pointing to the same number, I care.
That's the right question. Remember, this is a dispatch. The authors aren't setting policy. But the ECDC's May 9th rapid scientific advice draws on work like this when it sets an Andes-specific window, instead of falling back on generic hantavirus ranges. The hamster model gives you the inference. The ECDC document gives you the applied standard.
So the answer to, can I stop worrying, is ultimately downstream of a Syrian hamster in a BSL-4 lab in 2023. Fine, at least it's a specific Syrian hamster instead of just hantavirus in general.
If you like close daily tracking of complicated stories, try Musk v. Altman Daily. It's a court watch on Elon Musk's trial against Sam Altman, OpenAI, and Microsoft, covering testimony, exhibits, and the AGI governance fight. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes, along with the sources behind them. If something caught your ear, start there. That's Hantavirus Watch for today. This is a Lantern podcast.